This video featuring a man who identifies himself as Dr. Tarun Kothari and makes a few claims about COVID-19 is being shared widely on social media platforms. In this video, we verify his principal claims. The first claim is that wearing masks depletes oxygen levels, leading to several diseases that will require hospitalization, and he therefore urges people not to wear masks. This is false. All the relevant national and international health authorities like the World Health Organization and the USA Centers for Disease Control and Prevention recommend wearing masks to control the spread of COVID-19. The second claim is that the COVID-19 vaccine kills more people than the disease itself. India has witnessed over 4.1 lakh COVID-19 deaths, of which 41% of the total deaths occurred in April-May 2021 during the second wave. On the contrary, according to a report submitted by the National Adverse Events Following Immunization or AEFI, a 68-year-old man died of a severe allergic reaction post-vaccination on 8 March 2021. The death was reported as a vaccine product-related reaction. As of 19 July 2021, causality assessment for 179 serious and severe AEFI cases has been approved by the National AEFI Committee, of which only one death was found to be associated with the COVID-19 vaccine. According to the Health Ministry, as of 26 July 2021, 34.18 crore persons have been administered at least one dose of the vaccine. On the other hand, according to the USA CDC, out of the 339 million doses of COVID-19 vaccines administered in the United States, Vaccine Adverse Event Reporting System received 6,207 reports of death, that is 0.0018% among people who received a COVID-19 vaccine. They clarified that reports of adverse events following vaccination, including deaths, do not necessarily mean that a vaccine caused a health problem. The third claim is that COVID-19 is a simple flu that causes minimal deaths. While both influenza and COVID-19 are contagious respiratory illnesses, the differences between the two are stark. Flu is caused by influenza viruses, while COVID-19 is caused by the SARS-CoV-2 coronavirus, which is more virulent and dangerous than the normal flu. There are several differences between flu and COVID-19, but the main difference is that COVID-19 spreads much faster than the flu. The mortality rate for COVID-19 appears to be higher than that of influenza, especially seasonal influenza. The mortality rate from COVID-19 is yet to be determined accurately, but the crude mortality rate is between 3 to 4%, which is much higher than that of the flu, which is usually below 0.1%. Other differences are that COVID-19 takes longer incubation and recovery periods, complications are exacerbated by comorbidities, and external medical treatment can include hospitalization. So it is much more dangerous and life-threatening than the common flu. Navbharat Times has reported that Delhi police has registered an FIR against Dr. Tarun Kothari for his controversial comments and spreading misinformation that COVID-19 is a fake epidemic. Further research revealed that his 2 Facebook accounts have been blocked. Dr. Kothari has a history of spreading misinformation and is the author of a book titled Corona Pandemic Scandal. Despite removing his social media accounts, the misinformation sparked by him continues to spread. But as his claims have been proven false, we urge people to be careful while consuming information and only trust reliable sources like authorized health bodies.
When you come across a piece of news that seems too ridiculous to be true, don't leave things to doubt. Run searches on Google and Yandex and weigh out the true and false of the situation for yourself by looking at the facts. But first of all, before you hit that forward button, pause.